And it's World Mosquito Day, a day to raise awareness about the causes of malaria, how it can be prevented, and fundraising for research into its cure. We have public health analyst Awolabi Toby joining us now to talk more on this. Many thanks for your time.
Thank you for having me here.
Now, you understand that malaria is the highest cause of infant mortality in Africa. And so far, do you think we're winning this war against malaria?
I think if you look at history, you would see that there's a lot of progress. We are not where we want to be in terms of what we want to see, in terms of the indicators of number of people dying. However, there's been a huge change in the percentage of people dying, I mean number of children dying to malaria, and even number of pregnant women losing their lives to malaria. Like I said, that's not where we want to be, but I think it's a huge progress in terms of government, donor funding, and civil society organization activities.
So would that be what you attribute to the success we've achieved so far? What are those key indicators for you?
I would say the key indicators definitely is the number of lives saved. You know, the currency in the health sector is about the number of lives saved. And even though it might be difficult to get to 0 lives, I mean 0 lives lost, that's a huge challenge, which is the stage where we don't have malaria anymore in our society. However, the biggest indicator is, for example, the number of investment that goes into primary health care in Nigeria and Africa as a whole. And I should let you know that Nigeria and DR Congo account for the highest number of maternal mortality and child mortality as a result of malaria. Actually, 40% from the whole wide world, Nigeria and DR Congo takes this. Other big indicators would include private sector investment in this space and also the response. You know, you may not be able to prevent sometimes, but the response to treatment and management of malaria is also very, very important.
Okay, now we also understand that there's been research going on finding vaccination, you know, against malaria. What can you tell us about how far this has gone? Is it, you know, do you have faith that this can really be achieved?
Yeah, absolutely. So there's actually been a lot of trials, but we all know that scientific process, before it gets to the process of developing it into a drug, takes a long time. It could take sometimes 5 to 10 years. And the most recent advancement is what some researchers in the London School of Hygiene did, which is to develop 1 dosage for malaria. I think that's still a very big step compared to the normal 3 days or 3 times or something. But what is probably going to come out soon or going to be commercialized soon is the 1 dosage that's going to probably treat malaria. I believe from there's going to be another step to probably having an immunization for malaria. That's where everybody is very far from right now. But there's been a lot of trials in different parts of the world, in Switzerland, in the United States, even in China. There's been a lot of drugs, and the chemoprophylaxis also is providing lots of solutions.
The question many Africans would always ask is, why do we have to have research from other parts of the world where they don't have the problem of malaria? Why can't we just do these things ourselves?
I think that deals with investment in research, and we need to dedicate government funding also to research. So, for example, when we're talking about public health is not about awareness or just providing drug. The research process in public health takes huge millions of US dollars. And what that means is that government needs to dedicate a line item in their own budget. Civil society organizations need to do this. Tertiary institutions need to do this. And even private sector organizations need to support this system so that it can also come from us. But I should also let you know that when they say research comes from China, from the US, it doesn't only mean that it's US researchers or Chinese researchers that are doing this. Some of them are Nigerian researchers, Zimbabwean researchers as part of the team. So it's a teamwork, really. And then it's a global perspective. There are evidences from local work here that goes into international journals that actually inform international work in terms of
Absolutely, that's
research.
The concern also that Africa or Nigeria, we're not supporting our own researchers to do these things at home if they can do that. And there's also something about, we've heard about GMO mosquitoes in that research. Yeah. I'm concerned about that.
So the idea is, it's 2 ways, you know. There's been a lot of cases with resistance, and there's also, that is, a lot of mosquitoes are now even resisting approved malaria drug, which is a huge case in some countries and even in some part of Nigeria. However, because of different testing and they're trying to check what the transmission or how to break the patterns of transmission. So there's they are more like creating mosquitoes, but it's not like creating like that, because
I hope we don't create a vampire in the future.
It's not like
I hope we don't create a vampire.
Tweaking genes to see what could happen, because really it's only a type of mosquito that actually transmit malaria, which is the female Anopheles mosquito. So what happens if the female Anopheles mosquito cannot transmit malaria, rather than we even looking for drugs to prevent malaria? What that means is that there is no malaria. So that's why there's also a research in the line of tweaking genes and seeing, can we destroy the capacity of the female Anopheles mosquito to actually transmit malaria, probably through some injections or through some tweaking.
Okay, so we just have to work together to stop malaria.
Absolutely. Private sector, government agency, and all sectors.
Thank you so much for your time. We appreciate you.
Thank you very much.